prior to us breaking. The topic was still insurance reform, although obviously these things interrelate, and I suspect that people may have some other issues that they want to raise. After this, we're going to go to the issue of deficit, and which touches on some of the issues related to Medicare that have been raised already. And I'm going to actually have Joe Biden open that up.
Mr. President, before you leave, health reform, could I get on the list? I didn't know. I thought the whole thing was going to deal with health reform.
Well, no. I mean, we will be talking about health reform, Charlie. I guarantee you will be called on before. You'll have a chance to talk about all these issues. All right.
Mr. President, what time do you expect to end the meeting?
My hope is that we get out of here. We're running a little bit late, but for having a lot of elected officials sitting around a table, we're not too late. My hope is that we can adjourn by 4:15. All right? Okay. 4:15. Originally it was scheduled to go to 4. We're starting a little bit late on this front. So we'll see if we can get out here by 4:15. All right? That will require probably a little more discipline on all our parts, including myself, than was shown in the morning session. Although, let me just say that I thought the tone of the discussion was helpful, and I appreciate everybody's participation so far. With that, I'm going to go to Mike Enzi. I'm going to go to...
You're talking about leaving, Mr. President. Please put me on the list.
Well, I guarantee you guys are all going to have a chance to speak. But we're going to go to Mike Enzi, and then we're going to go to Tom Harkin. I know that we had Jay Rockefeller was still on the list. Was there another Republican that wanted to speak just on the insurance reform issues, or you want to go to John Barrasso? All right. We'll let you guys split time on this one. All right, Mike.
Thank you, Mr. President. Colleagues, when we're talking about insurance reform, we haven't really talked about, but Representative Slaughter kind of opened the door on it, and that's Medicare. Seniors out there are really nervous. Seniors are the ones objecting the most to the program, and it's because they see $500 billion coming out of their program. If Medicare were separate and any savings that we did in Medicare reform went back into Medicare, it would do a lot to relieve the tension that's out there. It'd even be a way to pay for the doc fix. So I'm hoping that can be a piece of what we're doing. I really appreciate this exchange. It would have been helpful had we had this 9 months or a year earlier and had it in even more detail and for more days. What we were presented with in the Help Committee, of course, was a bill that was already half drafted. And we started the markup on it, and then we got the other half later. And since we had not had any input to the drafting, we're credited with 150 amendments. Well, 17 of those amendments were Senator Murkowski, where she was inserting Native Americans and tribal in 17 different places. I had 11 of them where we put in a thing that required agencies to cooperate. So the ideas that we had, when Senator Kennedy and I were working bills, we'd set down some principles and then put some detail in and then draft the bills together. And I hope that's something that we go to on future bills. It works. In a 3-year period, he and I got 38 bills signed by the President. In the last year, I've gotten 2 that I've gotten pens from this President. And the way that we've done those has been through that kind of a process, and unless we go through that kind of a process, I don't think we can get to the bipartisan thing. And that's what the purpose of this meeting is to kind of get all these ideas together and see how they gel. In insurance reform, small business health plans, that's different than the AHPs, which is what they were talking about, and it covers some of the problems that were talked about. One of the problems is mandates, and Olympia Snowe contributed to that part. She had a provision that if 26 of the states adopted a mandate, it would be a mandate nationwide. And as other mandates became 26, they'd be included with it too. We talked about health savings accounts. I don't think that meets some of the federal minimum standards that the federal government might put on it. And that's going to disappoint some of our employees, because that is one of the options that federal employees have, is health savings accounts. And it's particularly good for the younger, healthier people. They can get that. They've got catastrophic coverage. If they put the amount of money that they would have spent on a Blue Cross plan or some other plan, the difference between the two, into a savings account, in 3 years they've covered the huge deductible. And they can continue to do that tax-free. So it's a process that would